Good morning, everyone, and welcome to our Wednesday Wellness Workshop. My name is Sarah Green. I am the Wellness Consultant for the Marcus Institute of Integrative Health at FAU Medicine. I'm so excited to see all of you here this morning on our virtual Wellness Workshop. This workshop comes to you from Heather Berg. She's going to be talking to you about a specific breathwork method called the Buteyko method. I always butcher the pronunciation of that. And we are just so excited to have you all here. Let me just give you a little bit of information, just go over really quick some housekeeping here. If everyone would please make sure that their cameras are off and their microphones are also off, that would be great. And if you have any questions, feel free to put those in the chat box while Heather's presenting. I will be taking notes and we will address those at a later time because we do have a 45-minute window for this presentation. The Marcus Institute of Integrative Health at FAU Medicine offers free weekly wellness workshops as well as classes that address nutrition, fitness, mindfulness, self-care, medical education, and a myriad of other wellness topics. If you'd like to learn more about our information, feel free to reach out to me, Sarah Green, at health.fau.edu directly. I can also put that in the chat box for your records, and we are always accepting new patients here at our practice. We have our FAU primary care practice as well as our Marcus Institute of Integrative Health practice. And so if you'd like more information about that, again, feel free to reach out to me. So with no further ado, I'm going to hand it over to Heather Berg, and I invite you all to listen, to learn, to breathe, and enjoy.
Beautiful. Thank you so much, Sarah. I really thank you and the Marcus Institute for asking me to present the Buteyko breathing method. Thank all of you for coming. So most of you, or maybe all of you, know who I am. My name is Heather Berg, and I am a yoga and meditation teacher, and I've been practicing since 1991 and teaching since 2012. And as many of you, whoops, sorry about that. Can you guys see? There we go. All right. And so, as many of you may know or may not know, breathwork is one of the 8 limbs of yoga, which has been an important part of my personal practice as well as my teaching. And the past 3 or 4 years, I've really taken a deep dive into pranayama, which is breathwork, yogic breathwork. And in March 2020, I came upon this incredible book by an investigative journalist. His name is James Nestor. The name of the book is Breath, The New Science of a Lost Art. I highly recommend you either get and read it or listen to it on Audible. It's really great. And it was through this book that I was introduced to the Buteyko breathing method, which I feel is in beautiful harmony with yogic breathwork. Hold on, let me make sure. There we go. So just a disclaimer, everyone, that this is just for informational purposes and it does not constitute medical advice. All right, what is the Buteyko breathing method? What is it all about? It's about bringing yourself back to functional breathing. It's about relieving stuffiness of the nose so that you can breathe easier through it. It's about opening the airways in the lungs so that you can stop coughing and wheezing if you have that issue chronically. It's about improving blood circulation for better oxygen transportation throughout the body. It's about achieving better sleep, an increased state of calm, better focus, and emotional stability. I apologize. Hold on one moment. All right, so how does it work? So before I go through those bullet points there, hold on one second. I just want to close something so I can see better. There we go. So before I go through all those bullet points, how does the Buteyko breathing method work? So your breathing style has developed over your lifetime, and it's as much a part of you as the way you walk. You don't think much about it. The exercises, and there are 6 main exercises, and because of the time restraints, I'm not going to be able to go through all of them. I'm just going to really touch base towards the end of the lecture, talk about a few of them. But the exercises help to reset your breathing pattern back to a more functional process. And changing your breathing pattern is like learning to ride a bike, right? Like you can talk about it, you can think about it, you can read about it, but the only way to be successful is to practice it. All right. So improving your breathing will not happen overnight, but by practicing the exercises, most people see positive results, sometimes right away in terms of mitigating some symptoms, which we'll talk about. And over time, it can take just a few weeks to really see some changes. Buteyko breathing method is a clinically proven, natural, safe breathing retraining program, which utilizes the body's self-healing capacities. The Buteyko breathing method is a lifestyle choice, and it involves educating your breathing pattern to improve blood circulation, oxygen delivery, and airway functioning. Right. Here he is, Dr. Konstantin Buteyko. Part of Dr. Buteyko's research was to study the composition of oxygen of astronauts. But as a medical doctor, he spent time at the bedside of sick patients and observed that the sicker the patients became, the heavier, the faster, and the bigger volume of breath they breathed. And he noticed that they breathed through their mouths. And when that happens, they breathed in their upper chest, and it was super shallow. And so he really wondered, he asked himself this question: was it their sickness that caused the dysfunctional breathing, or was it their increased breathing feeding back into their sickness? And he also witnessed that when he could help his patients bring their breathing volume down, when he guided them to be sure that they were breathing through their noses, when they were breathing lightly, slowly, deep, meaning low, their symptoms lessened or they even disappeared. And he even tried this on his own. He had a type of high blood pressure, and he changed his breathing to make sure he was breathing through his nose, breathe lightly, slowly, and deeply. And he was able to manage and normalize his own blood pressure. And he started to do more research on other health conditions and how they were affected by breathing. So just to show by the bullet points, you saw in 1946, commenced medical training at the first medical institute in Moscow. His practical assignments were really monitoring the breathing volume of patients. Like I said, he questioned the sicker they became, the heavier they breathed, or was it the heavier they breathed, did that make them sicker? And he was able to bring down his own blood pressure. All right, who do you know with allergies, asthma, constant stuffy nose, sleeping issues, snoring, sleep apnea, irritable bowel syndrome, syndrome, sorry, high blood pressure, PMS, or menopausal symptoms. And did you know that there is a common habit that underlies all of those conditions plus more? What is that underlying condition? Over breathing. So I'm just going to tell you something. Over breathing, hyperventilation syndrome, or dysfunctional breathing They're all the same thing. So throughout this lecture, you'll hear me say overbreathing, or sometimes you might hear me say hyperventilation syndrome or dysfunctional breathing. It's all the same thing, okay? So if I asked you what it means to overeat, we all know, right? Of course you understand. It means eating an amount of food greater than your body needs. And so overbreathing, likewise, is about taking in a bigger volume of air than your body needs. And you might believe that you don't overbreathe, but it's often hidden. And here are some of the characteristics of those who have overbreathing, hyperventilation syndrome, or dysfunctional breathing. So you yourself, or someone you might know, constant yawning, chronic sighing, mouth breathing, wheezing, coughing, snoring, sleep apnea, digestive issues, exhaustion, anxiety. Now, these are just some of them, right? So here's a definition. Dysfunctional breathing, or not a definition, it's actually a stat. Dysfunctional breathing or hyperventilation syndrome has an estimated prevalence of 9.5% in the general adult population, which doesn't seem like such a big percentage. However, these are people who basically had no complaints or no symptoms, okay? So these are people who they said didn't have asthma or allergies or anxiety or high blood pressure. Hyperventilation disorders affect 30% of asthmatics and about 75% of anxiety sufferers. Now, if you think about it, how many people do you know who have anxiety? How many people do you know who have asthma? So these percentages are really high. So hyperventilation is not always what you think, where you see someone and they're breathing heavily when someone's in the midst of a panic attack. Remember, it can show up as excessive yawning, excessive sighing, burping, snoring, bad digestion. And there is a definition of hyperventilation: breathing in excess of your metabolic needs. And so when that happens, you get depleted of carbon dioxide. All right. So if you take a breath, you inhale through the nose and exhale through the nose and hold the breath, you begin to get uncomfortable. So I want you to try that. I want you to just inhale through your nose, exhale through your nose, and hold your breath. Okay? And just notice as you're holding your breath, you're starting to get okay. And of course, go ahead, let go, begin to breathe. So when you do that, eventually your autonomic nervous system tells us it's time to inhale again. And many people believe that feeling of air hunger means that you are lacking oxygen. So this desire to breathe has nothing to do with a loss of oxygen. So when I asked you to hold your breath and all of a sudden you get uncomfortable, that uncomfortable feeling has nothing to do with your body saying, oh, I need more oxygen. It has everything to do with your intolerance to even the slightest increase of carbon dioxide. Okay, I'm going to explain this a little bit more. There's this common misperception that it is the lack of oxygen. And I thought this before I really began to study the Buteyko breathing method. And it's actually the buildup of carbon dioxide in the body that is the stimulus to breathe. So besides that, and I'm going to explain that a little bit more in a moment, but I want to talk about the benefits of carbon dioxide. So number one, it's a vasodilator. What does that mean, right? It just means that it allows your blood vessels to expand. And so that way your blood pressure can lower, it can relax smooth muscles. So like people who have IBS, for example, it's really important for the smooth muscles to relax. And so if we have a buildup of CO2, that's a good thing for you. It's also, CO2 is a bronchodilator, which means it helps open the airways. CO2 stimulates the vagus nerve, which can create a sense of calm in the body. I'll talk about that a little bit later as well. And then most importantly, you need a certain level of carbon dioxide in your blood in order for oxygen to absorb efficiently into the cells. Okay, let me explain that again. So let me back up a minute. When we breathe, we inhale oxygen, we exhale carbon dioxide, right? Now, if you're exhaling heavily or constantly breathing through the mouth, you're exhaling too much carbon dioxide. You need a certain level of carbon dioxide in your blood in order for the oxygen that you're inhaling to absorb into your cells. Okay, so carbon dioxide is the stimulus to breathe. All right, let's move. All right, I want to talk to you about the Bohr effect. In 1904, which is really amazing that this was discovered in 1904. In 1904, a Danish scientist by the name of Christian Bohr made the discovery that you need a certain level of carbon dioxide, what I was just explaining before. So when carbon dioxide is a little bit on the low side, which means someone is breathing heavily, often through the mouth, they're hyperventilating, they cough a lot, they have asthma, whatever they snore, that means your carbon dioxide most probably is a little on the low side. Okay, so when carbon dioxide is a little bit on the low side, less oxygen is absorbing into the tissues, your organs, and your cells. And when CO2, carbon dioxide, is a little bit on the higher side, which means maybe you're breathing through your nose, you're breathing slower, you're breathing lighter, and you're breathing deep, which means, and I'll explain later as well, it just means that you're breathing low in the lower part of the lungs. So when the carbon dioxide is on the higher side, extra oxygen is released from the blood into the tissues and cells. This is called the Bohr effect. All right, so along with breathing lightly, slowly, and deeply, it's very easy to remember that, LSD. So along with breathing lightly, slowly, and deeply, using your diaphragm efficiently, it's important to breathe through your nose. So just that right there is the basis behind the Buteyko breathing method. Breathing through the nose, breathing lightly, slowly, and deeply. So faster and bigger inhales of oxygen are not better for you. In fact, it decreases your carbon dioxide levels. And again, that's the Bohr effect. You need a certain amount of carbon dioxide present for the oxygen to absorb into your tissues, cells, and organs efficiently. And so through overbreathing, also known as hyperventilation, dysfunctional breathing, so through overbreathing, we can develop a habit of chronic hyperventilation. All right. So as this screen says, increased respiratory rate, which means breathing bigger, breathing faster, does not increase oxygen levels. In fact, it decreases your carbon dioxide, which basically deoxygenates your blood. All right. Why do we overbreathe? It has to do with our diet. It has to do with a lack of exercise. It has to do with talking a lot. It has to do with stress. It has to do with allergies and asthma. These are the main reasons. Let's talk about diet. Hold on a moment. Diet. We overbreathe when we overeat. So overeating increases breathing volume due to the additional work that's required by the body to process and digest the extra food. So that's even if you eat healthy, you eat too much. Now, if you eat junk food, processed food, which is usually acidic, the body tries to maintain the correct pH balance and increases breathing. We overbreathe when we don't exercise enough. Okay, so when we move our bodies regularly, we move our muscles, we exercise, it actually generates the gas CO2, carbon dioxide, which helps maintain body oxygenation. And so lack of exercise results in a lower production of CO2. And when you have a lower production of CO2, we get that feeling of like we need more air, and so we breathe more. And that's not good. All right, here's a big one. Excessive fast talking contributes to overbreathing. So I'm going to stop for a moment and breathe. I've had to practice that a lot. Large amounts of air are inhaled between sentences. When I listen to a lot of podcasts, I can pick up immediately when someone is breathing in lots of extra air and they're talking quickly, talking. I mean, already it makes me want to cough. So be mindful of that if you talk for a living, all right? Stress. No one has stress, right? None of you have stress in your life. Being in a state of stress can create overbreathing. Chronic hyperventilation is often a contributory factor with panic attacks, agoraphobia, anxiety, irregular breathing, breathing through the mouth, breathing heavily, breathing too much, contributes to reduced oxygen delivery to the brain, which then creates agitation of the mind. We can get headaches, stiff muscles, poor digestion. The stress activates our fight or flight response, which increases our breathing to prepare us for physical or emotional stimulation. All right. Can you address your emotional, your mental state without looking at your breathing and how you sleep? No. You can do all the cognitive behavioral therapy or any type of therapy in the world, but from a physiological point of view, therapy doesn't change your respiratory, how you breathe physiology during sleep, right? So think about it, like look at this picture of this woman. Many of us might sleep like this, you know, where we fall asleep and the mouth goes open, right? And then all of a sudden, all night long, our mouth is open, we're exhaling too much carbon dioxide, which then means the oxygen is not absorbing efficiently into our organs. And so we can wake up feeling exhausted, and it can affect our emotions. And then when we wake up all day, we're just feeling kind of sluggish. And if your emotions are off, your sleep is off, and it's this vicious cycle. So it's really important, people who have, you know, stress, anxiety, depression, and you're working with therapists or doctors, or even for yourself, it's so important to work on your breathing physiology. All right. Asthma, another one, asthma, allergies, coughing. This also causes overbreathing. Studies have shown that people with asthma breathe 2 to 3 times more air than people without asthma. Overbreathing occurs unconsciously and can create irritation, inflammation, and constriction in the airways. So for those of you who have asthma, I probably don't need to explain this, but for those of you who don't, as your airways constrict, you feel kind of suffocated. And as a result, your breathing increases, trying to mitigate that feeling of not getting enough air. However, this increase of breathing volume further feeds into the symptoms, causing greater constriction, and there's this vicious cycle. All right, guys, readjust how you're sitting. And I want you to clasp your hands, inhale, and exhale. All right, taking a deep breath. I hope you inhaled and exhaled through your nose. I can't see you because your screens are off, which is fine. But just kind of notice what you did. What does it even mean to take a deep breath? Psychotherapists, coaches, meditation teachers, yoga and fitness instructors, myself included. I often used to, don't now, I really watch my words, but often encourage the practice of taking this big, deep breath, thinking that I'm bringing more oxygen into the body. But if you remember, I'm just going back to that Bohr effect. We inhale oxygen, we exhale carbon dioxide, and we need a certain amount of carbon dioxide present in order for that oxygen to absorb into your organs, your cells, your muscles, when we need to maintain that balance. So the practice of taking a big breath, thinking that it allows more oxygen into the body, is often encouraged, but it's not correct. The confusion may lie in the belief that a deep breath means a big breath. So let's think about this. Think of the word deep. What is the opposite of deep? Shallow. So if you're breathing shallowly, it means that you're breathing in up here in the throat, up here in the chest. And that's what happens most often when you breathe through your mouth. So go ahead and try this. Sit up straight. I want you to just tip your chin towards your chest. And I want you to breathe through your mouth. Take a breath and just look down at your chest and breathe through your mouth. Notice what moves. And then now I want you to take a breath. You don't need to take a big breath, but just breathe through your nose, chin towards the chest, breathe through your nose. I'm hopeful that you saw a difference. When you breathe through the mouth, really the upper chest moves much more compared to when you breathe through the nose. Ideally, when you're breathing through the nose, there's not a lot of chest expansion or upward movement in your chest or in your shoulders. So all of these factors that I went through, diet, excessive talking, lack of exercise, stress, the importance of sleep hygiene, allergies, asthma, and the belief that a big, large breath, all of those create dysfunctional breathing. So slowing the breath rate without addressing the tidal volume, which means the amount. Let me back up a minute before we read this quote on the screen. In yoga, in meditation, even therapists, doctors, they they tell us to slow down our breathing, which is a great thing, which is true. We should slow down our breathing. But we often fail to address the volume, the amount of air. We can slow the breath, but if it's still a big breath, we can still be hyperventilating. So now with this, what I wrote on the screen, slowing the breath rate without addressing the tidal volume does not normalize the oxygen CO2 levels. And that's a big issue with most yoga approaches to pranayama, I have found. I know for many years, that's how I taught, some breath work, some pranayama, where I would say, take a nice, big, slow breath. We don't want big. We want slow, but we don't want big. So if we're in the habit of breathing through our mouth, a large volume of air, quickly, heavily, this habit of dysfunctional breathing becomes ingrained. I love this quote by Wayne Dyer: healthy habits are learned in the same way as unhealthy ones, through practice. All right, just wanted to show you this breathing volume for a normal person, basically with no medical symptoms, no asthma, nothing major going on. The number of breaths per minute is about 10 to 12 breaths. Dysfunctional breathing, someone with asthma, COPD, people who snore, sleep apnea, they breathe about 15 to 20 breaths per minute. So much of the population breathes, I must say, dysfunctionally. They might breathe through their mouth, they may have shallow breathing, they may not breathe with their diaphragm efficiently, they might breathe heavily. And while most people think they breathe through their nose, like I really believed I breathe a lot through my nose. And in yoga class, when I would take a class, definitely I would breathe through my nose. I believe when maybe I'm watching TV, I breathe through my nose. But I talk for a living, right? I fall asleep on the couch. You can ask my husband, and I'm sure my mouth would open up. And so I begin to breathe through my mouth. And that's what would happen at night as well. So while most people think they breathe through their nose, mouth breathing occurs during talking, during pretty extensive exercise. If you watch people run, it's unbelievable. They breathe through their mouth. And in sleep, people with allergies, people with congestion, suggesting that it might be a lot more prevalent than you know. Hold on, I'm sorry if that adjusted my screen. All right. So it has been estimated that up to 30 to 50% of modern adults breathe through the mouth, especially during the early morning hours. And there's an increased chance of sleep apnea, snoring, and this puts stress on the cardiovascular system. And like I said, here are some of the effects of mouth breathing: snoring, bad breath, dry mouth, hoarseness, exhausted upon waking. It can affect your head posture. It could actually affect your chin. It might be drawn in because the mouth drops open, the cheeks sink. We can get jaw pain, neck tightness, headaches. That's a lot, right? But we're human and we like to talk and we like to laugh and we like to eat and sing, even swimming. We need to breathe through our mouth when we swim. But a little air intake through the mouth is not going to kill you. The good news is that you can retrain yourself to breathe through your nose as much as possible. And that's a big part of the Buteyko breathing method. The nose is built with a specific purpose: to support our respiratory system. The primary purpose of the mouth is to start the digestive process. So the only organ that helps us breathe correctly is the nose. And the mouth is really meant to be a backup system to our breathing. I apologize that the screen is, part of it is being cut off. I'm thinking, wait, I think I'm fixing it. Hold on, everyone. All right, good, all right. Benefits of nasal breathing. Functional breathing starts with nasal breathing. The normal mode of breathing for human beings is in and out of the nose. Even most animals breathe through their nose. Dogs breathe through their mouth when they're regulating their body temperature. The benefits of nasal breathing. I could have a 2-hour webinar on the benefits of nasal breathing. I'm just going to let you know. Nasal breathing, it filters the air, it warms the air, it moistens the air, it regulates your breathing volume, and it harnesses nitric oxide. And some of you are probably like, well, what's that? I'll talk about that. Like I said, the most important aspect of functional breathing is habitually breathing through the nose. We have this magical gas produced in our nasal cavities called nitric oxide. In 1998, there were 3 American scientists who were awarded the Nobel Prize for their discoveries about nitric oxide as a signaling molecule in the cardiovascular system. And they also discovered that it's produced in the nose and the paranasal cavity. This is the best part. It is known to be antifungal, antibacterial, anti-inflammatory, and a bronchodilator. So that when you inhale through the nose, for example, we inhale through the nose, nitric oxide is pooling. So it's antifungal, antibacterial, anti-inflammatory. It goes down into your lungs, and then it's a bronchodilator. So every time we nasal breathe, we produce nitric oxide and it's transported to your lungs. This is what's really amazing. When we're done with this, you need to Google nitric oxide and COVID. Really interesting. Make sure you make an effort to breathe through your nose. It will help that much more to keep you healthy. So mouth breathers lose the benefits of nitric oxide. Just a little bit more information. Nitric oxide enhances memory, learning. This is when they discovered this. This is when they discovered, oh my God, why can't I think of the name of the pill? But it enables erectile function. It reverses heart disease and strokes. All right. Don't laugh at the picture. Mouth taping can help you breathe through your nose. All right. So when I started doing this and playing around, so I've been, it's been, I think about a year that I can't remember now. No. I've been taping my mouth, I think, since January, not a year. I started by doing it vertically like that. And now I tape my mouth horizontally. Please do not try this unless you speak with someone like me who's trained, who can walk you through it. There's another type of tape you can see that goes around the mouth that my teacher, Patrick McEwen, who happened to study with Dr. Buteyko, he developed that tape. Okay, so to ensure nasal breathing, mouth breathing has been proven to have many of those health issues, which I talked about. Taping of the mouth, there hasn't been a lot of research in traditional medicine, but it has been done for years. So using tape reduces, when you tape your mouth at night, reduces common colds, less allergies, less asthma symptoms, and it increases nitric oxide. All right, so mouth taping can help when you wake up in the morning, helps fatigue and brain fog upon waking, It helps dry mouth. It helps prevent tooth decay. It helps your disrupted sleep. I was getting night sweats and I don't get them anymore. It's amazing. Helps with snoring, nightmares. All right. So if we consistently breathe through our mouth, our diaphragm will not function efficiently. Of course, we can breathe through our mouth. I'm sure many of you breathe through your mouth and you're still here, okay? But we want everything to work efficiently. Nasal breathing supports diaphragmatic breathing. Excuse me. There's a strong physiological connection between the primary organ of respiration, which is our nose, and the primary muscle of respiration, which is the diaphragm. And this partnership between the nose and the diaphragm stimulates the parasympathetic nervous system, which is the relaxation response. And some of the benefits of the parasympathetic dominance are you're calm, you're more clear-headed, you get better sleep, good digestion, healthy weight, strong immune system. So as you can see, it's really important to make an effort to breathe through your nose. This then will allow All right, I'm back. Can you hear me? Okay, let me share my screen again. Let's see, advanced portion of the screen. Sorry, I have to talk my way through this. Oh, look at that. Is it work? Can you see? Thumbs up? Yes, you can see? Okay, I just want to change this. I apologize. Okay. So it stimulates the vagus nerve when we breathe slowly. Slow breathing creates this rhythmic movement of the diaphragm, which stimulates the vagus nerve. For those of you who are not familiar, the vagus nerve is the 10th and most extensive cranial nerve. It starts in the base of the spine and it wanders through the body and it emerges directly from the brain and runs right down into the abdomen and connecting major organs. And so when we breathe through the nose so that our diaphragm works efficiently and we breathe slowly, lightly, and deeply, we're stimulating the vagus nerve. All right, there are 6 main exercises, and today is just an overview. I mean, this is like, I can talk about asthma and the Buteyko breathing method for a few days. I can talk about sleep apnea and sleep hygiene and the Buteyko breathing method. So like I said, I'm just touching on little parts so that you can get an overview of what this is about. There are 6 main exercises. And one of the first exercises that I do when I work with either small groups or work with someone one-on-one, there is a measurement that's called the control pause. And it's basically a measurement of your tolerance to CO2, to carbon dioxide. Because remember when I had you, when I was talking about the buildup of carbon dioxide, it's the trigger to breathe. Remember, when we hold the breath, we inhale, we exhale, and I had you hold the breath, and that feeling that you need to breathe, that feeling that you need to breathe is a buildup of carbon dioxide. So the control pause is basically measuring how comfortably you can hold your breath. And so we only have probably like about 5 minutes left. And as much as I would love to do this with you, and we can do this, I can work one-on-one, or we can get small groups together. But if you want to take a screenshot of this, and then I can talk to you more about it. It's just, what we do is you take a normal inhale through the nose, a normal exhale through the nose, you pinch and hold the nose, and you hold your breath until you get that very first inkling that you need to breathe. So it might be a little constriction of your throat, or you might feel a little like kind of movement of your diaphragm, and then you release the nose and you breathe normally. And you do this with a timer, okay? And depending on the number, it just can determine. So if you have a low number, meaning, you know, if it's under 10 seconds, right? If it's under 10 seconds, it's just saying that you have a very high, you don't have a very high tolerance to CO2. And then the good news is that the Buteyko breathing method can help you with this. All right. This is a real important one. This one, it's how to unblock your nose. So if your nose is feeling blocked, and I'm sure many of you were thinking this earlier when I was talking, how can I breathe through my nose if it's congested? Believe it or not, breath holds after the exhale can help unblock the nose. So if your nose is feeling blocked, it's worth doing these nose clearing exercises. So this one, I just want to show you for a minute. So you can like take your phone and make sure it's like on off, kind of like you don't want it like this. You want to make sure it's black, and you're not breathing through your mouth. You inhale, you exhale through your nose. And then you can see, I don't know if you could see, there are like these little halos of where exhaled. I apologize if you can't see that. It's just a way to see if maybe one nostril is more blocked than the other. Another way to do it is just to see. I'm pretty open on both sides. This is this exercise, just letting you know if you are pregnant, high blood pressure, going through any sort of cancer treatment, please do not practice this. There is a different exercise that I would be able to teach you to do to unblock the nose. Your mouth would be closed. You inhale through the nose. You exhale through the nose. You pinch and hold the nose. You nod your head up and down. And you're basically holding your breath as long as you can. And then you let go and you try to breathe naturally. And you can repeat this 3, 4, 5, 6 times, and you wait about 30 seconds between each one. Breath holds. What we're doing is we're harnessing that nitric oxide, which is a dilator. And that's what helps open up the airways. There are so many different types of breathing exercises that today, I will not be able to go through with you, but I hope it's tempting you to come to a later workshop with me. There's also a way to stop a cough. I'll just read this one quickly. The first sign of a cough, like you feel it. I actually feel it now from doing a lot of talking. Put your hand over your mouth. Swallow. Hold the breath after an exhale. And then begin to breathe slowly through your nose. It's really interesting. It can really help. It takes a lot of practice. So what are steps that you can implement right now? How long will it take? I mean, steps you can implement now. Breathe through your nose 24 hours a day, 7 days a week. Obviously, we can't do that because we eat, but breathe through your nose as much as possible. Mouth taping during the day while you're watching TV, while you're working on the computer, maybe at night to ensure nasal breathing. If you're interested in that, definitely connect with me. If you are a chronic yawner, sigher, if you feel it coming, same thing, swallow. Try to keep your mouth closed. And make sure you cannot hear your own breathing during rest. A perfect man breathes as if he is not breathing. I love that quote. So here's how to connect with me. So if you want, you can take a screenshot of that. My email address, I'm on Instagram, I'm on Facebook, I'm on YouTube. Thank you, Sarah. I was trying to squeeze it all in, and thank you to the Marcus Institute of Integrative Health.
Thank you, Heather. That was so informative and so well presented. So much information. I know we really could do an entire series just on the Buteyko method, and so we will explore that moving forward. Heather is a regular teacher for us over here at the Marcus Institute of Integrative Health, everything from breathwork to yoga. And many of you know her outside of this setting and know what a gift she is to the wellness community. So I thank you, Heather, so much for sharing your expertise and time with all of us today. I did include all of my information in the contact chat box, so feel free to reach out if you would like a recording or any further information about the Marcus Institute of Integrative Health. Have a beautiful, healthy Wednesday, and please stay tuned. You can follow us on FAU Medicine's Facebook page for our weekly Wellness Wednesday workshops. Have a beautiful day, everyone. Stay well.